Assalamu alaikum everyone, dear participants and organizers of the International Brain and Biomedicine Conference. The topic of my presentation is cumulative effect of nutraceuticals in polycystic ovary syndrome patients. And my name is Dr. Razia Noreen. I am Associate Professor in the Department of Biochemistry, Government College University, Faisalabad. The polycystic ovary syndrome is actually diagnosed with the irregular menstrual cycles. And this is characterized by infertility, obesity, and hypercholesterolemia and cardiovascular diseases. PCOS patients clinically presenting with following three types of symptoms. Physical signs are the presence of small cyst on ultrasound scan in the single or both ovaries, and irregular menstrual cycle were observed in the patients with the PCOS. Here we can see the image of the normal ovary, which is with the normal functioning of ovulation by corpus luteum and producing the primary follicles, secondary follicles, and mature follicles with the normal phenomena. Whereas whenever there is the issue of the polycystic ovary syndrome, then this development after these secondary follicles have been stopped in the patients which have the cyst on their sides, and there are multiple immature follicles are starting to produce. So PCOS is a complex disease with the insulin resistance, high androgen levels, fluctuating gonadotropin kinetics, and obesity. Insulin resistance and hyperinsulinemia are the common symptoms of PCOS. The women with the PCOS have impaired glucose tolerance, androgens, and imbalance in the hormones. PCOS has 4% prevalence rate in the females. So natural ways for the treatment of PCOS are the need to investigate for the better results. So flax seeds and cinnamon, which have been used in this study for the treatment of this issue on the base of enriched in lignin and omega-3 polyunsaturated fatty acids, which contains the phytoestrogens to prevent the hyperandrogenism. Whereas the cinnamon, which have been selected, it has an insulin sensitizing effect to treat the various metabolic disorders. The more clear symptoms are the obesity, which is have the risk of infertility is increased by being the obese, which is by the 24 kg per meter square with increasing the BMI. Weight reduction can restore the regular menstrual cycle in the polycystic ovary syndrome patients. Moreover, the disturbance in the glucose metabolism, in which the poor glucose digestion, transportation, and diabetes type 2 are risk for all women with the PCOS. So no obese PCOS prevalence rate is 10.3 and 1.5 is higher than the general population, leading to diabetes. So the regular diabetes screening and the monitoring are the essential for young women with the PCOS. Infertility is also a common gynae endocrine disorder that is caused by the PCOS and due to the lack of ovulation. Overproduction of hormones can lead to the irregular periods and insulin resistance. Hirsutism, which is the oily skin, and acne are the indicators of androgens abundance, which leads to the hirsutism. In these, the doctors, they check for the male dominating features like hairs on the chins, and take into account the ethnic background when determining the hirsutism. So they also recommend for the male hormone imbalancing test for the confirmation of hirsutism. So the objective of our study was to analyze the effect of flax seeds and anti-androgenic cinnamons as insulin sensitizing agent in improving the metabolic indicators, which are very crucial to female reproductive health in the community-based diseases. If we go for the phytochemistry of the cinnamon, so we need that it is a member of a Luriaceae family, and due to the presence of its polyphenols and flavonoids with the antioxidants and free radical scavenging effects, it provides the anti-hyperlipidemic effect and anti-diabetic effect. And regarding the flax seeds, they have been used in the treatment since the 6000 BC before. And flax is native to the Mediterranean, Asia, and Middle East, and that contains the lignans and mucilage which have the health benefits. Moreover, due to the presence of anti-diabetic, anti-malarial, antioxidant, anti-carcinogenic, anti-inflammatory properties which are linked to the flax seeds, they have analogous also with the hormonal effects as the intrinsic estrogens to control those hormones which are elevated in the PCOS problems. So for this purpose, we have selected the flax seeds and cinnamon. They were purchased, washed, and dried, kept in the cool places. And then the capsules were prepared by using these powders, and they were safe for the 72 days. It was a completely randomized design, and the study have been conducted in the gynae outpatient department, Tehsil Hyderabad headquarters hospital, Pattoki, Pakistan, for the 6 months. And for this purpose, the ethical review committee permission letter have been also obtained by the university, and 50 female subjects have been taken. 5 groups were made, and each group contained the 10 subjects. First 2 groups were the negative and positive control, and the other 3 are the treatment groups. Fasting blood glucose as the routine and special chemistry test have been used, and fasting blood glucose and lipid profile tests were performed on the automated chemistry analyzer. Moreover, these tests for the fasting glucose, moreover, the special chemistry test including luteinizing hormone and follicle stimulating hormone ratio, progesterone, and estradiol, free testosterone, and fasting insulin have been also analyzed. And weight measurement, which is also the very important factor due to the obesity, which is linked with the PCOS, so it has been measured before and after the study, and obesity, which is actually the root cause of the PCOS. So lifestyle modifications such as healthy diet and avoiding the junk foods have been advised to the patients during this study. Radiological evaluations have been performed by the consent of the doctor with the multiple tiny cysts on the periphery of the ovaries of the patients, and safety evaluations. For the safety evaluations, the liver and renal function tests have been performed also. The results of our study, they have shown that the blood sugar level, it showed the non-significant level due to the presence of this cinnamon aldehyde in our treatment groups. Cinnamon affects the metabolic indicators and glycemic status. Moreover, the flaxseed and cinnamon, as these 2 are the groups, one group have the flaxseed, one group has the cinnamon, and the one group which has been advised to take the flaxseed and cinnamon both as a mixture. So they did not show the significant result on the fasting insulin level, which is under the controlled conditions. And cinnamon group showed the improved results on fasting insulin levels. It have been the level of the insulin have been improved by using these cinnamon. Cinnamon group did not show any significant result regarding the body weight. So here is the this graph actually indicates the effect of cinnamon and flax seeds on the fasting lipid profile in PCOS patients. And here if we look at this graph, we can see that the fasting lipid profile test in which tests have been performed for total cholesterol and triglycerides, high density lipoproteins, and it showed the significant result in different groups. Then we have performed the endocrinological evaluations and the effect of cinnamon and flax seeds on the hormones concentrations, which are very important for the ovulation, ovarian volume, etc. So the in treatment groups, flax seeds plus cinnamon group showed the significant result. It means that if patient take both, those patients who have been using the flaxseed and cinnamon in combination, they have a significant results, and the reduction in the hormones in PCOS patients have been observed significantly. And in this is actually the effect of cinnamon and flaxseed on concentration of liver function test, which have been very normal. And the renal function test also showed the normal result. So it means that the cinnamon and flax seeds, they have showed no adverse effect on the patient's liver test and the renal function test. So by concluding this talk, we can say that in vitro study shown the mechanism of action of flax seeds by binding free androgen, overcoming root cause in management of PCOS. Cinnamon intriguing the mechanism of insulin activation that is helpful for controlling diabetic abnormalities. All indicators, blood glucose, insulin level, lipid profile, androgens levels showed significant result on the PCOS. So this study reveals that the natural common sources might be the better treatment to control this issue as compared to the commercial treatment. And as I will lastly conclude that every disease, it has a psychological effect on our brain, on our health. And the patients, when they come to know they are suffering from some diseases, whatever they are, but naturally, the human being and their brain, their central nervous system, it captures the message of this problem, and the patients, and they need to improve their mental health also to combat with the disease. And there are the natural remedies or solutions which have been already using for the treatment of PCOS, but they are in the form of seed therapies which have been already used. So this trial of cinnamon and flax seeds improved the studies which have been already going on in our lab, and we are further investigating the more natural products to overcome this PCOS. Thank you very much.